Hi, Dr. Juliano. How are you?
Very good, thank you.
So you recently did a case with Adaptiiv. I'm just wondering if you could summarize what that case was.
So we proceeded with a case of a rather large squamous cell carcinoma of the scalp that had been resected. Recognizing that it was on the occiput, we were going to have challenges with having a daily bolus application, and we needed something that was going to be able to contour to the scalp quite nicely, and needed to find something that would fill that niche, and Adaptiiv proved very helpful in this regard.
And how did you find the bolus fit on the patient?
So one of the things that we realized is that in an effort to have the bolus contoured and to allow for some reproducibility, I did an exaggerated case of the bolus so that it encompassed the scalp starting from basically the base of the neck all the way up into the forehead. That would allow for better purchase, let's say, of the bolus on the scalp. We did find some challenges with it. The conformality was not the issue, but rather the patient's hair would get bunched up and such. So one of the things to consider is if a patient has a very thick hair, thick hairline or something like this, you may want to have them either cut their hair down to sort of a buzz cut of sorts, or but certainly if this was a bald patient, there would be no issues. It's perfect. It's amazing, actually.
And how would you have bolused this otherwise?
It's a good question. There are obviously challenges here for reproducibility. This particular gentleman is a 2 to 3 person assist on the table, an elderly man, probably just around 80 years old, not very mobile, so putting him in the prone position on a daily basis was not going to be acceptable, which would have been the proper alternative or the best alternative. So honestly, this would have been very difficult to get a satisfactory plan otherwise with the current, sort of bolus applications that we have. To be honest with you, I'm not sure. When I knew that I had this option available to me, it became the proper solution. It'd be challenging otherwise, for sure.
And what would you say are the main advantages to using 3D bolus in this scenario?
So there's a couple things. Number one, that you have to consider. Number one, you actually have time to plan. So with this, there's not the same pressures of, let's say you have to start somebody emergently. So it allows you to be very, very careful in your planning. And that allows for time for you to actually think about the proper placement of your bolus and what your needs are. And actually, we found that the team at Adaptiiv has been very helpful in orchestrating this, and the turnaround times have been exceptional. So it really doesn't add too much time to the treatment planning, which is really quite nice. So that shouldn't be seen as a challenge at all. I think in my own mind, having the ability to really conform to a structure, allows for consistency of the treatment, and you're going to get much more accurate planning when it comes down to your evaluation of either the treatment plan, and then you're going to get much more accurate delivery when completing treatments every day. So there's just going to be advantages for anything with an irregular contour that you find challenges with the current existing, bolus materials that we have, and that proved challenging really for the past 20 or so years that I've been doing this, 20 to 30 actually years that I've been doing this. So.
Nice. And what kind of cases do you think you'll use this in the future?
So I've got 2 additional cases underway, one active treatment for a nose, and the advantage here is that I have one in the soft tissue triangle of the nasal tip that's extending sort of into the intranasally. So that particular case is really quite nice because we were able to conform a mold that also had an endonasal component to it, which adds not only to your consistency of planning, but also it forms a sort of nice hugging conformal applicator that can be reproduced on a daily basis. So that's nice. I have a second nasal case that has not started yet, but we're facing a similar issue in that it's right at the nasolabial crease, and so being able to have a bolus that's shaped, and again, anchored within the nose is going to allow for a much better treatment experience. So I guess the other thing that can be tailored is really the thickness of the bolus, which for some people, obviously you might need 5 millimeters to 1 centimeter, but at any range within you can customize, and we found that there's a nice, let's say, quality control of the product. So when we get the bolus, it is entirely of uniform consistency. It's remarkable. So I feel like there's a nice tight quality control on behalf of Adaptiiv, so we can be confident in the material that we're getting.